Welcome to the Attention Deficit Disorder Expert Podcast Series by Attitude Magazine.
Hey everyone, good afternoon. I'm Susan Kaufman. I'm here with this week's Attitude Magazine ADHD Experts webinar broadcast, and it's about an important topic, one that I know there's a lot of interest in, and that is cognitive behavior therapy called CBT and dialectical behavior therapy called DBT, and how these therapies can help adults with attention deficit disorder. Let me just underscore that this presentation is about treating adults with ADHD. You're welcome to listen in if you are interested in helping a child or a teen, but be aware that the presentation was designed to address adults with ADHD. So, cognitive behavior therapy and dialectical behavior therapy are two treatments, ADHD treatment approaches that are familiar to many adults with ADHD, but there are lots of questions out there, and I know we hear them at Attitude. What's the difference between CBT and DBT? What is a typical session like? How does it work? How well does it work for ADHD symptoms? How long does one go to sessions on CBT or DBT? And so we're really, really pleased today to welcome Dr. John Mitchell, who's an assistant professor in the Department of Psychiatry and Behavioral Science at Duke University Medical Center. Dr. Mitchell provides clinical services at the Duke ADHD program, where he supervises clinical trainees, delivers workshops on the treatment of ADHD in adulthood, and conducts clinical research involving ADHD in adulthood. He's published over 60 peer-reviewed publications and book chapters on ADHD, and served as the principal investigator for research grants provided from the National Institute on Drug Abuse, the National Institute of Allergy and Infectious Diseases, as well as funding from the American Professional Society of ADHD and Related Disorders, where he's conducting a stage 1 trial of mindfulness meditation training for adults diagnosed with ADHD. So interesting topics. Dr. Mitchell, thrilled to have you join us. Thank you so much for your time. To our listeners, let me just make a few comments about how the webinar will work. Dr. Mitchell will present his slides, and then he will take your questions in the time that remains. You may post them at any time that they occur to you in the Ask a Question section of the screen. His slides are available for download now, and the slides in the Event Resources tab of the screen. When the webinar ends, a post-event survey will pop up, and it will ask 3 questions about the webinar, and that will be followed by 3 more questions titled Required for Attendance Certificate. So if you'd like a certificate of attendance, which will be emailed to you, submit answers to those last 3 questions. If you're listening to this on our webinar on replay on our site, please visit the replay page on the Attitude website for clear instructions on webinar certificates of attendance. And finally, I'd like to point out that audio problems are almost always due to slow internet connections. So we strongly advise you close any open browser tabs and maximize your internet bandwidth. So with that, let me turn it over to Dr. Mitchell, again, with our deepest thanks.
Great. Well, thank you very much for the introduction, and thank you very much for having me, and happy for all of you who are listening so we can talk about cognitive behavioral therapy and dialectical behavior therapy for ADHD in adulthood. Also, it's getting towards the end of the month, but it's October, so happy ADHD Awareness Month.
Right.
Right. And then in addition to, kind of what I do right now, clinically and research-wise, it's very much immersed in ADHD, particularly in adults. I think one reason that I'm giving this talk is that I have a training in both cognitive behavioral therapy, both for ADHD and non-ADHD populations, and then also I've received formal training in dialectical behavior therapy, which was originally created to help people with borderline personality disorder, and that was in the context in which I learned that. So, and then also another caveat is that in this talk, I will list some book recommendations. 2 things about that. One is that the books that I list here are examples, but not an exhaustive list. And secondly, any books that I'm recommending, I'm not going to benefit from the sale of them or anything like that. So I just want to disclose that there's no conflicts of interest or any perceived conflicts of interest. So let's get to the task at hand today. So we've got two broad goals, defining what is cognitive behavioral therapy and how that works for adults with ADHD. And I also want to provide some examples of what that might look like. And then also talk about what is dialectical behavior therapy and how that's been adapted for ADHD, and provide some examples of what that might look like. And so one of my goals is for people who are listening to get an idea of what these may look like, and if you're interested in pursuing them, this will provide a foundation for which you can go forward and try to find a provider in your community to seek out these treatments. All right. So, first of all, I want to talk about cognitive behavioral therapy and dialectical behavior therapy, and I'm going to use CBT and DBT as the acronyms for them for the rest of this talk. And the reason that I wanted to talk about how they're related is because, like Susan mentioned at the start, there's questions about how are they related, and they're separate treatments, but they're not unrelated treatments. And so cognitive behavioral therapy and CBT and DBT, they're related hierarchically, and they're part of the same family. So both are considered forms of behavior therapy. And a lot of people consider behavior therapy developing in three waves. And so the first wave of behavior therapy from the late 50s and 60s was based on therapies using basic behavioral principles, operant and classical conditioning paradigms. And these waves were associated with, I've here up on the slides, Joseph Wolpe, the gentleman next to him, Hans Eysenck. These were pioneers in the field at that time for a behavioral therapy tradition. Then if you move to the right, where you see founders of cognitive behavioral therapy, so this was the second wave, and this was the introduction of cognitive therapy. So it basically took the principles of that first wave of behavior therapy and expanded upon it by adding in a focus on human cognitive processes. So basically, what are the role of thoughts and how can they affect your behavior and things around you? And one of the main components of the cognitive piece was that cognitions, or just another way for saying thoughts or self-talk, can be modified. And when you modify them, they can impact behavior. And then there's the third wave. And with this, we see third wave behavior therapies include therapies like DBT, acceptance and commitment therapy, or ACT, or mindfulness-based cognitive therapy, or MBCT. And these are still within the behavioral therapy tradition, but they've added on a component of acceptance and mindfulness in the course of behavior change. So you see then CBT is with that second wave, and then DBT more with the third wave. And then as treatments like DBT have developed, that has informed the development of CBT. And so we do have some overlap between them. And in fact, just to demonstrate this about CBT and DBT, both being behavior therapies and part of the same family, so this is the name of the treatment manual for DBT that was published back in 1993. So DBT was originally developed for borderline personality disorder, and the title of this book was Cognitive Behavioral Treatment of Borderline Personality Disorder. So DBT and CBT are certainly separate, but this just is to demonstrate that there is some overlap. And then, in fact, this was a quote from one of a treatment outcome study conducted among young adults with ADHD, in which they tested the impact of DBT. And one way that they described DBT is that DBT was designed to flexibly incorporate cognitive behavioral strategies and mindfulness acceptance strategies. So, as we'll see, getting DBT as an adult does not ensure that you're receiving the same kind of CBT skills that we'll be talking about in here, but DBT can encapsulate some CBT skills training. Okay, so let's go ahead and define what we mean by CBT for ADHD in adulthood. And before we even get to that, I first wanted to get at what is CBT? When I say CBT, what do I mean? So just like there's a lot of different medications to treat a number of different conditions, there's a number of different therapies for a number of different conditions. And so CBT is one form of psychotherapy. And what sets CBT apart is that it focuses on teaching clients specific skills with an emphasis on ways that a person's cognitions or their thoughts, emotions, and behaviors are connected and affect one another. And because emotions, thoughts, and behaviors are all linked, CBT approaches allow for therapists to intervene at different points in the cycle. And I'll demonstrate what that might look like in the next couple of slides. A couple of other things about CBT is that with CBT, the therapist and the client work together. So this is very much a collaborative process. The therapist has the theoretical and technical expertise. So as a therapist, I might know what are the strategies in a treatment manual that have been used, that have been shown in research to help with ADHD behaviors. But the client is the expert on him or herself. And so typically what we end up doing in therapy is that we adapt the skills and we adapt it to make it work for the individual. So it's very much an individualized approach. And whenever you do that individualized approach, it really has to be a collaborative effort between the therapist and the client, as opposed to the client just coming in to soak up the knowledge from the therapist. It's not a one-way street like that. It's very much both ways and reciprocal. Also, treatment is goal-oriented to resolve current problems, and clients work step by step to achieve goals. So I joke sometimes that CBT is it's sometimes the worst sales pitch for adults with ADHD because it is it's very goal oriented, but it's step by step. It's iterative. It builds on each other. It involves homework and sticking with it over time. And when you have a population that's characterized by difficulty, sticking with long-term projects and avoidance of things like homework historically when they were in school, it's not the best sales pitch. But that being the case, CBT is a feasible and acceptable treatment for adults with ADHD, and as we'll see, it's been shown to work too. So clients learn new ways to engage in adaptive thoughts and behaviors. And so the whole focus of the treatment is what are different behavioral strategies you can try and implement them, and how do you implement them consistently over time. And also, how can you change the way that you interact with your cognitions or your self-talk or your thoughts. And when I say cognition, self-talk, thoughts, I'm referring to the same thing. It's just things that we're thinking. Throughout CBT, you track progress toward goals throughout treatment. And so this is to make sure that what we're targeting is actually being targeted. So if you're coming in and you're wanting to work on ADHD behaviors, we want CBT to work. And CBT by definition, it's a time-limited therapy. It's maybe, it can vary in duration, but in general, 6 to 20 sessions. And the plan is for you to come in, make improvements on the areas that you want to improve on, and where these are clearly defined behavioral goals and outcomes. And we want to make sure, if we're not making progress, to try to troubleshoot that. And so that's why it's important to track progress throughout treatment. And then, like I mentioned, there's homework. So homework assignments are often included in therapy. So the skills are taught in therapy, and so what happens in the therapy room is really important. But what I like to emphasize with clients that I work with is that it's, but where the magic really happens is when you're outside of the therapy room, and that's where the key stuff occurs. How do you implement it? And when you try to implement it, and you have difficulty with the whole purpose of CBT sessions are to come back and try to problem solve through that. And so it's very much an iterative process that takes time, it's homework, and it's collaborative. And so this figure captures a lot of how you might think of CBT. So we all have thoughts, we all have emotions, and we all have behaviors. And each one of these impact one another. And at each of these points, there are opportunities to intervene using CBT strategies to modify some kind of outcome. So that the cognitive piece, the C in CBT, there were different people in the 70s that were developing this approach. Aaron Beck is one of them, and he developed it for patients with depression. And so one classical way that this may play out for depression is that, let's say that, so I'm just going to start at the top of the pyramid here. You have a thought, I'm no good at this. And then if you move down to emotions, probably the more you tell yourself that you're no good at this, you're going to probably be more likely to feel depressed. And then when you feel more depressed, then we'll move over to behaviors. And then you may modify your behavior. Instead of going out with your friends, you may watch TV instead. And then when you engage in that behavior, you may engage in other kinds of thoughts, such as nobody likes me. And you might think, because look, I'm staying at home instead of going out with my friends. And so these are all points at which we can intervene. And this is a typical way that it might play out with depression. But of course, we're not here for depression. So let's talk about how this might play out for ADHD. So imagine you're an adult with ADHD, you're starting your day at work, and you have so much to do. You have that one thing you really need to work on, but you've been putting it off, and the clock's really ticking. So what are you doing? Well, let's say that instead of working on that thing, as indicated in the box here, you're on Facebook, and you're checking your Facebook. So that's the behavior that you're engaging in. So you're avoiding the task that is the most important thing, and instead of approaching that task, you're on Facebook. Okay, so then you're on Facebook, and you might notice that this is going on. You might have a thought, gosh, I can't stick to a plan or do anything right. So you have these I can't kind of thoughts. And then when you have these I can't kind of thoughts, that may affect you emotionally. So you may feel frustrated. You may feel overwhelmed. And probably when you feel frustrated and overwhelmed, if we go over to that behavior box, it might be harder to motivate yourself to go ahead and tackle that thing that's the most important thing to do. Because after all, you're telling yourself you can't do it, and you're feeling more frustrated. And so this becomes life. It's an endless cycle of emotions, behaviors, and thoughts that are impacting one another, and it's kind of this downward spiral. And so one thing that we try to do in CBT is to try to intervene at these different points and pull you out of that spiral. So what might this look like? So let's say for behaviors, we have this thing called the ABC technique for planning. So this is a technique, and it's called by different names and different treatment manuals. But basically what this is a prioritized task list in which you plan out your day and you prioritize different tasks that you want to accomplish. And you're not doing it in the heat of the moment where you're thinking, oh my gosh, I have to get this done, and it's feeling like the last minute, or you're having the urge to procrastinate. This is doing it in kind of a fresher state of mind. So maybe in the morning, you wake up, you have your coffee, and you do your ABC list. And you think, okay, what are the things that are important to get done? What are A tasks? A tasks are tasks that have to get done today. What are B tasks? B tasks are tasks that can get done after all of the A's, maybe in a day, maybe in a couple days. And then what are C tasks? C tasks are tasks that can get done after the B's. And so these might be things that we're not going to get to until a week from now or even further beyond that. And to give you an example of what that might look like, and also an example of how we adapt things for treatment, this is something that I used with someone, and it's all de-identified, of course, where writing out the whole ABC task list was kind of difficult, because that might be a list of like 30 items on your to-do list, and you're writing that out each day. So with this individual, we were just trying to focus on getting some behaviors going. So we had this menu of options, so you can see daily options menu of different tasks that this individual could engage in each day and that they might want to add to their task list. And then at the bottom, we basically had their 3 A's. So what are the 3 things that you would like to do today? And what we do in therapy is that we start off with something like this, or something like this, a modified ABC task list, or a traditional ABC task list, and then we'll adapt it. whether it's the way that it looks or you have A tasks on there, things that you're saying I have to get done today that aren't getting done, then we troubleshoot it. We break it down into smaller components. We figure out a ways to touch the task, as one of my colleagues, Russ Ramsey, says. So ways to initiate an approaching task that you might otherwise put off. Okay, so that's just one strategy. That's a behavioral strategy. Now, what about cognitive strategies? So these I can't do this kind of thoughts, or I'm no good at this, or I can't get my stuff together, I can't follow a calendar. The kinds of behaviors that are going to probably lead to more, the kind of the cognitions that are going to probably lead to more ADHD behaviors. So in cognitive therapy, what we typically use is a thought journal, something like this. And so here's an example. So on the left side, we have what happens before you have the thought. So this is the who, what, when, where, why. So in this example, let's say that you're at home, it's Tuesday, and you received a late fee for your cable bill. And then you have an automatic thought. I can't remember anything. My whole life is a wreck. I have in there overgeneralizing. So one thing that we try to do when we track these automatic thoughts is we try to identify what are the general trends in these thoughts. And so this one we might call overgeneralizing. Okay, and then when you had that thought, I can't remember anything, my whole life is a wreck, right after you looked at that late fee for your cable bill, then what emotions did you experience? Sad, frustrated, overwhelmed, unmotivated. And so this is kind of the validity check. So this is a validity check for knowing this is something that I want to, this is a worthy automatic thought to address, because after all, it's making me feel sad, frustrated, overwhelmed, and unmotivated. And those are all states that individuals are not looking for. They're not going to want to feel sad, frustrated, overwhelmed, unmotivated. So with cognitive therapy, one thing that you do is you just identify what are my thinking patterns, what are the patterns of my automatic thoughts. And so we might do one or two of these a day, so that you come in after a full week and see your therapist, and you can look at all of these I can't remember anything thoughts, my whole life is a wreck kind of thoughts. Once you identify those patterns in your thinking, then we introduce this fourth column. What is an alternative / adaptive thought to replace the harmful thought? And so in this example, we might have something like, well, logically, saying I can't remember anything is just factually incorrect. There have been times when I've remembered to pay a bill on time. You could use motivating thoughts to encourage breaking out of the cycle. So, for example, I'm learning skills to help me remember things like paying my bills on time, because I'm in cognitive behavioral therapy. Or you could have a thought like this. This is a reminder that I have to use my calendar. So like a reminder to use a behavioral strategy to break out of this kind of routine. So a key thing here, and something that typically comes up with clients, is they say, oh, you mean you want me to think positively? And no, that's not it at all. We're focused not on positive thinking. We're focused on adaptive thinking. And now it is true that you might have a negative thought, and we might, in the second column, and we might want to introduce more of a positive thought in the rightmost column, but the goal here is not to think positive. The goal here is to think adaptively. And by adaptive, I mean breaking out of ADHD behavioral routines that are causing problems for you on a daily basis. And so when you're formulating that rightmost column, so how do you reply to those automatic thoughts? Here's a couple of examples of thoughts or of different things that you may want to cue yourself when you're thinking or you're trying to come up with an alternative thought. So ask yourself, is there an alternative explanation for this? Asking yourself, is this automatic thought completely true? Asking yourself, what would a good coach say? So your good coach wouldn't say, you can't do this. Your good coach would say, okay, here's what you got to do so that next time you're ready. And then go through the steps. Do this, then this, and then this. Similarly, what would a good friend say to me about this? What would I say to a good friend about this situation if he or she were going through it? And then also, how can I say this automatic thought in a more helpful way that will help me accomplish my goal of, and so in this example, my goal to pay my bills on time. So this is a technique that it takes time to learn, much like the ABC technique, any other cognitive behavioral strategies, they take time. And why are we targeting these thoughts in the first place? The reason that we're targeting the behaviors is because difficulty planning, time management difficulty, these are core symptoms of ADHD. But what about thoughts? The reason that we're targeting those is that people with ADHD tend to engage in more depressive thinking, even when they don't have the depression. So to demonstrate this was a study that we did a couple of years ago. And we looked at scores on an automatic thought questionnaire that really measures the severity of your depressive thoughts. And we had 3 groups that you can see here, those with ADHD and depression, adults with ADHD only, and a group without ADHD or depression. And what we found was that our group with depression scored higher on these depressive thoughts than those without ADHD or depression, and they also scored higher than those just with ADHD. But we also found that those with ADHD, even when you took out the depression, they're still engaging in more depressive thinking than people without. Okay, so they're more depressive thinkers, adults with ADHD in general. And then also we find, somewhat paradoxically, or it seems paradoxical at first, that adults with ADHD also have these overly optimistic thoughts as well. So these might be thoughts like, I can get it done in one night, I work best under pressure, and I do well without planning. And these are thoughts, automatic thoughts, that are not negative like the I can't thoughts that we were just talking about. They're actually positive. They're saying, I can do this. And I love it when clients that I work with say, I can do this, because I want to play off of that. But at the same time, if these are thoughts that are encouraging engagement in ADHD behaviors, this is where we get to that distinction of we're not trying to have positive thoughts, because this is a positive thought, but this could also be a maladaptive thought if that means that you keep putting off your tasks and you're doing things at the last minute, and that's exactly what you're trying not to do. So you can use traditional cognitive behavioral strategies like the thought journal, like what we went over with the 4 different columns. This is an example of something else that we might use. This isn't in any treatment manual, but is in a review article that was published a couple years ago. And I think for the sake of time, we're not going to get too much into this, but basically what we're doing is much like the thought journal with the 4 different columns that we looked at a couple of slides ago. We're identifying the situation that triggers an event. We're looking at the emotional response, and we're also looking at the thought, the automatic thought. And then in traditional cognitive therapy, we would have that 4th column. How do I respond to myself? What's an alternative thought? Here, instead of an alternative thought, we say, let's introduce a behavioral strategy. So what can I do in this circumstance? So I don't have too much time to go into this because I also want to talk more about DBT. Also, another thing is coping card statements. So this is from a colleague and well-known author, clinician, and researcher, Russ Ramsey, using coping card statements. So these are like your ready-to-go 4th column statements. Whenever you run into ADHD behaviors that are getting in the way. So these are things just like quick reminders. So when you're feeling overwhelmed with something, you're not sure where to start, what's the first thing I should do? What's the first step? Define the first step of a task. If you found that you overcommit to things regularly, and as a result you get overwhelmed because your schedule is a mess because the things are not that planful in your schedule. This is a reminder to notice the feeling, but wait, don't act on it. So wait on that urge to say, yeah, I can do that. Instead say, actually, I can't answer that right now. Another great coping card statement is buy time and say, let me get back to you. That's good for good time management. And then also, what would your defense attorney or a good friend with ADHD say to you in this situation? So these are all kinds of coping statements to cue you to engage in a different kind of thinking style and to cue you to engage in a different behavioral style. Okay, so what do the treatments look like themselves? So this is a manualized treatment that's been through randomized controlled trials by Steve Safran and colleagues up at Mass General Hospital. This is an individual therapy. That these are 1 hour sessions, last for 12 sessions, typically weekly. Typical session will look like setting up an agenda at the start, reviewing the symptoms and how the symptoms are getting in the way, reviewing any difficulties with medication adherence. Then you review a skill from the past session. So let's say we would review the ABC technique that we went over, and then we review a new skill. So let's say that we review the ABC technique, and then we say, okay, today we're moving on to the cognitive therapy module, and let's talk about how do we respond to maladaptive self-talk. There's also treatment manuals. So these are not for people with ADHD necessarily to go out and purchase. These are how-to manuals for clinicians to administer these treatments. But I'm putting them up here just to kind of give you an idea of what it looks like. This one is developed by Mary Salanto, and this is a 12-session group therapy. These are 2 hour sessions, and you can see here the content of what these sessions focus on. Just like the other treatment, it follows a cognitive behavioral tradition. And then there's also other clinician manuals. And so again, this is not for clients with ADHD, but more for clinicians who are administering these treatments. But the reason that I'm putting them up here is that if you're out there in the community and asking people for treatments, you might want to, see if they're aware of these kinds of publications to see, when they say they're doing CBT, you might want to ask, well, when you say CBT, how specific is it for ADHD? Because these are some examples of how it's specific for ADHD. And then also there's many books for adults with ADHD that follow a CBT format. This is just a selective sample of just 2. There's many, many others. This is not an exhaustive list, but just a few just to demonstrate. And then also, this is not just about talking about skills, but learning how to implement them day after day after day. And so there's a great podcast through attitudemagazine.com on integrating these skills into your daily life. And so it's a great resource. Okay, so I don't have much time to talk about DBT, but that was purposeful. And here, I'll explain why. Not that it doesn't deserve the time. But okay, first of all, what is DBT? So DBT was developed as a treatment for borderline personality disorders, and it has 4 different modes of treatment delivery. And so this is different from many other forms of psychotherapy. CBT, like what we had just talked about, it could be in a group format or an individual therapy format, but typically not both. The full DBT model is different. This involves individual therapy, a DBT skills training that is typically done in a group format, in-the-moment phone coaching, and also DBT consultation teams for therapists as well. Now, the D in here is dialectical. So a dialectic is a synthesis or integration of opposites. So in DBT, dialectical strategies help both the therapist and the client get unstuck from extreme conditions. And so a pillar of DBT is in this dialectical stance is on balancing acceptance and change. So this can be a highly effective place to practice dialectical thinking. So dialectics and DBT teach us that we can accept the way things are, but that doesn't mean that we're going to have to be doomed or stuck in that same place for forever. So it takes the pressure off of judging yourself in the current situation and gives you motivation to take positive steps towards change. So this is really accepting things in the present moment and trying to change things in the future. And for that change, we introduce the behavioral strategies. So this means that we assess the situations and target behaviors that are relevant to our clients' goals to figure out how to solve the problems in their lives. And so this could be behavioral strategies like we do in traditional CBT or not. But going back to how DBT has 4 components, when we say DBT for adult ADHD, we're typically talking about the skills training component. There is an exception, and we'll go through that, but we're typically talking about, when we say DBT for adult ADHD, from my experience, what people are saying is DBT skills training for adults with ADHD. Okay, so I'm going to actually jump forward a few, let me jump forward a few slides. Let's see if I can get through here, because I've got a slide on what a typical DBT session looks like. And all that this lists right here is, this is from an article, a treatment outcome study, listing out what you went through each session. And the reason that I listed that out here is because unlike CBT, there are no clinician manuals. There are no how-to manuals on how to adapt it for adults with ADHD that are published. So therefore, this is a more difficult treatment to find in the community than CBT. DBT is not difficult to find, but DBT skills training for adults with ADHD is more difficult to find because, again, there is no clinician manual. But what does this skills training look like? So these are 2-hour sessions. There's 12 sessions that meet weekly, and then plus in this study, they had monthly sessions that followed up all the way up to 21 weeks out. And then the sessions are broken up into 2 broad components. First of all, it's a greeting. You do a mindfulness meditation exercise. There's a discussion of accomplished therapeutic tasks. So how did you do in the past week with the use of skills? And then also talking about consolidation of the theme from the last week and try to connect it with what's new here. The second part in this treatment involves a mindfulness meditation exercise. And I'm not going to talk too much about mindfulness meditation because one of my colleagues, Lydia Zyloska, is going to be giving a webinar on that pretty soon, I believe, through this means. There's an introduction, discussion of a new skill. You assign the skill, so assign your homework, and then you wrap up the session. So this is what it looks like from another treatment study. And so for this study, this one was a little bit different. They had the group, and this is the session-by-session outline of what they did for group, for 90-minute sessions for 9 sessions total. But they also had 15-minute pre-group individual sessions. And then also they had 7 phone calls that involved coaching. What that looks like is, again, these are treatment studies. These are not through published manuals, so it's relatively more difficult to find in the community, again, where it's been adapted for ADHD. And so that's why I really wanted to spend more time describing the CBT, but of course we can talk about any questions or concerns people have. So again, I know I sound a bit like a broken record, but if you're seeking DBT as a treatment for ADHD, one thing is, am I getting DBT or DBT skills training? All but one of the studies that have been done for looking at DBT on the impact on adults with ADHD, they've all been DBT skills training groups as opposed to the full DBT model. And then also if you're out asking for it in the community and asking clinicians, are they doing DBT or are they doing it modified for ADHD? And I think as of now, as far as I'm aware, is that those clinicians would have to contact the researchers who did these studies to get their treatment manuals. Okay. And then wrapping up, what is the evidence of CBT and DBT for ADHD and adulthood? So basically there's been 5 studies comparing cognitive behavioral therapy against a wait list. So basically they had adults with ADHD and they randomized them to CBT or to no treatment and to wait for treatment. And then they measured ADHD symptoms among other outcome variables at the start and at the end of the treatment period or the non-treatment period if you're a part of the wait list group. Those studies have consistently shown that ADHD symptoms and related things, executive functioning behaviors improve when you go through cognitive behavioral therapy. When you can compare cognitive behavioral therapy against an active control group, so in these studies, if you're an adult with ADHD in the study, you get randomized to receive CBT or some other kind of treatment. And the other treatments varied. And basically, across the 3 studies that have been done, you see here SMD. So that's just a metric for measuring improvement. So that's the SMD is the standardized mean difference. And basically what this number means here, the 0.43, is this is a small to moderate effect size. So basically this is saying that ADHD symptoms improve when you compare CBT against an active treatment comparison group in a small or moderate kind of way, but a significant way nonetheless. Division 12 of the American Psychological Association, just to kind of demonstrate what the consensus is so far, they list out different psychiatric disorders and what are the non-medication treatments that have had strong empirical support. And you can see here, this is just a snippet from their website. They list cognitive behavioral therapy as a treatment with strong research support. And so if you go to their website, you can see that there, and that's in the source down at the bottom. And then for DBT, there's also studies that have looked at DBT skills training versus a waitlist control condition, and DBT skills training versus an active control group. And this research tells a very similar story as it does for CBT. There are caveats to this, but in general, you see improvement in ADHD symptoms. There's overlap between the DBT skills and CBT skills in some points. There haven't been any studies pitting cognitive behavioral therapy for adult ADHD against DBT. So there might be questions about which one is more effective over the other. I would say from a practical standpoint, you're going to be more likely to find somebody that does CBT for adult ADHD than DBT for adult ADHD in the community. But that's something that we can discuss in any other topics. So thank you very much, everyone, for listening, and looking forward to discussing now.
Thank you. That was great. Lots of questions here. Let me just back up a second and ask if you could just recap the difference between DBT and CBT. I know maybe that's a big question, but I found that it wasn't really clear to me what the difference was between the two.
Right. So the way that it's done in the research literature, DBT skills training is done in a group. Cognitive behavioral therapy can be done in an individual or group setting. DBT can include CBT strategies, but also has a stronger emphasis on mindfulness and acceptance strategies as well.
Okay, accepting yourself as you are, or whatever.
Right. And that's doing the best that we can to differentiate them, because also a good CBT therapist is going to probably integrate acceptance and mindfulness.
Okay.
Yeah. So if it's confusing, then that might be just about right, because there is a lot of overlap for people who are listening.
Got it. Okay. Great. Let's see. One of the comments from some of the listeners is that some of them have done some bit of CBT, and they found that, they help with understanding and recognizing, but making the change in behavior is more difficult. And they didn't always feel that their behavior changed. They felt that they may have gotten a better understanding of what was happening or why their emotions were as they were. How is it best practiced so as to actually achieve change?
Yeah. And, well, I would say one prelude to change in behavior is a better understanding of how things play out with your ADHD from a cognitive behavioral framework. And so, so getting that better understanding that that the people asking the questions alluded to, that's important, and it's important to get that better understanding. And then once you get that better understanding, then one of the next steps is, okay, now that I understand, what can I do to change my behavior? And that's a common struggle. People who experience that are not alone. I would be surprised to hear that people didn't have that, actually.
Right.
Because it's really, once you learn what to do and you understand it, then implementing it is always, that's such a big part of therapy, and that's where that really gets into the weeds, into the details about how do I consistently implement this over time. And so, what I would say to people who have experienced that is that that's a common experience, and in that situation, it takes hard work. I think Robin Williams has a quote that therapy is a full-time job, and I think that really captures it. It's a lot of hard work, and even when you know what to do, it doesn't translate into your everyday routine, and that's where a lot of the hard work in CBT lies.
And so, do you find success often results in how many sessions? It seems 12 sessions wouldn't necessarily be adequate for putting in place changes in behavior. What's your experience with behavior change in terms of the length of time?
Yeah. Well, I guess I could speak to it two different ways. One could be through the research literature, and the treatment studies that have been done, like 12 sessions. It might vary, but the Solanto treatment is a 12-session treatment manual. The Saffron treatment manual, I believe, is 12 sessions as well. And so there have been studies where you pit CBT against another active treatment comparison group, and you just have 12 sessions, and you do see change, and you do see change that can last, they follow them. I think the farthest they've gone out is a year. But then also there's, you're trying to engage in change strategies for behaviors and thoughts that people might have been engaging in for decades. Because after all, the childhood onset disorder, so it's always been there by definition. And so that is where, it's good that we have a treatment that is 12 sessions, but sometimes it takes more time, and it might not be learning the techniques that extra time is needed for, but instead what's needed is finding out how do I consistently implement this over time. And so in that case, then it can go over 12 sessions very easily. And I can say in my experience as a therapist that happens.
Right,
Certainly.
I'm sure, yeah. And is there a difference between the success with group sessions rather than individual?
Yeah, that's a great question. To my knowledge, no, there hasn't been, to my knowledge, a comparison between both of those treatments. And so, like in our clinic, we offer both, and part of the decision-making process on what is best for you is to, talk with a clinician who's well-versed in this, who can kind of bring the knowledge on what the research says. But then I would say the person looking for treatment to also kind of bring in what they think might be helpful for them, because there's pros and cons of each. Doing group therapy can be a pro of that, is that you not just get the skills, but you get validation from other people who have had similar struggles, and that is a really important thing. At the same time, in individual therapy, you might not get that, but you do get more, you can drill down and individualize some of the techniques more than what you might have time for in group therapy. So if somebody's kind of weighing whether or not to do one or the other, I would say write out a pros and cons list. And, and at some point, it's time to dive in. No matter how much you deliberate, spend some time and then go ahead and, take the plunge.
Okay. That sounds logical. There are a couple of questions relating to the fact that oftentimes people with ADHD have low follow-through don't do homework, have a hard time getting started on the tasks that might be involved. This must come up in CBT and DBT with people with ADHD. How is that? Are those tendencies handled, I guess, is the question.
Oh, right. Well, so that happens very regularly. I mean, everybody.
Sort of inconsistent follow-through, right?
Yeah. And in fact, so one thing that we do in treatment is that we address that head on. So what are the typical ADHD behaviors that you engage in outside of therapy, and how do we want to anticipate that in therapy? Because what you, of course, don't want is you don't want your therapist to turn into that teacher that always got on your case about not turning in assignments. We don't want that kind of environment. We want therapy to be collaborative and comfortable and positive and safe. And the main thing is to have a plan, to say, okay, what are we going to do, not if, but when a homework assignment is not completed. And it's less about, nobody's there to make the person feel bad for not doing it. Instead, everybody's there working towards the same goal. And that's what we're always asking. Okay, you didn't get it done. How do we get there? What can I do to support you in that? And that's the kind of mentality and approach that we like to have in CBT.
Okay. That makes sense. Does CBT or DBT is it ever approach for couples?
Oh, right.
Which one partner has ADHD and the other doesn't?
Yeah. Let's see. So Brian Wims, he's at Ohio University, but when he was at University of Pittsburgh, he modified one of these individual therapy approaches for adults with ADHD, and modified it for couples, where you have one person with ADHD and the other one, I suppose, with or without. That being said, that's a study that they had done and a review article that was written. Since then, there have been a couple of books that have come out written for couples, where you have one with ADHD, and I think the last name is Orlov of one of those authors. I apologize if I may be wrong on that, but so there are materials out there. Because that's a common theme,
right?
And it's not uncommon that a spouse or significant other might be the driving force or the final straw that gets someone into treatment.
Right. Yeah, that makes sense. Right. Someone's asking whether you can recap your distinction between positive thinking versus adaptive thinking, which was an interesting distinction. In the process of doing CBT. Right.
Yeah, that's a great question. So I might have a positive thought that I'm really good at doing things last minute, but that may encourage me to engage in more putting things off and procrastination, which I don't want to do. So in that example, that's a positive thought. I'm really good at this, but it's a maladaptive thought, because it leads to more ADHD behaviors that can cause more problems in life.
I see.
Yeah. And so I think that the main outcome that we want to be focused on is not necessarily thinking positive, but thinking, how will this help me break out of my ADHD routines that are causing problems? And that's where it's adaptive. It's they can transpose adaptive with helpful.
Okay. But it sort of starts with the assumption that you've figured out what the behavior is, and then, as opposed to positive, which might be just sort of ignoring it or moving forward, sounds like.
Right.
A question which a number of people have raised is the relationship of CBT or DBT to medication. Is it more effective if the adult with ADHD is on medication? Is it irrelevant? What is the relationship between CBT, behavior change, and medication?
Oh, that's a great question. So first we'll do CBT. So to my knowledge, there have been two studies that have looked at this, and so when you compare cognitive behavioral therapy and medication, and by medication, stimulants in adults with ADHD versus stimulants alone, cognitive behavioral therapy and medication has a better outcome than medication alone. And then when you compare CBT plus medication versus CBT alone, CBT plus medication does better than CBT alone.
Okay.
Yeah.
Interesting.
Yeah. That might, and that's it's saying that out loud. It can probably sound confusing, but yeah. So what this might mean then is if you're looking out, at treatment options, I would say cast a wide net. Look into, we know medications, we know stimulants work for adults with ADHD, so look into medication options and look into CBT. And whenever, I have somebody that comes in for an assessment and they want to know about treatment options and they're unsure about a treatment option, whether it's CBT or medication, what I recommend is that people learn about their options. And it doesn't mean that you're going to be wed to this treatment for the rest of your life, but that you're simply looking into it. So I would recommend looking into it. But in general, I guess the bottom line then is CBT plus medication.
Right. And is that the case that CBT and medication might address different aspects of symptoms?
Right. Yeah. Yes, yeah, and there's a nice quote: "Pills don't teach skills."
Right.
And so so the medication may help with some of the core symptoms, but then that may afford you some some more cognitive ability to adapt some of your behavior and modify some of your traditional thinking patterns.
Right. Okay. Which would certainly require a great deal of focus in order to change your behavior. So yeah,
exactly. So if you can have that better focus, then perhaps medication will help enhance that process of learning strategies.
Back for a second to the DBT versus CBT question, which I think is still very difficult for people. As a clinician, in what situation might you recommend DBT as opposed to CBT to an adult with ADHD? What might suggest to you that DBT made more sense?
Right. Well, so there's DBT, and then there's DBT for adult ADHD. I would recommend somebody for DBT if maybe they had a co-occurring disorder with borderline personality disorder, because DBT was a treatment developed for borderline personality disorder. Now, if there's a question of should I refer this person for DBT skills training for adults with ADHD, the fact is, I have a difficult time finding providers in the area that offer that.
Right.
So I would say it would come down to a practical issue, and that goes back to, DBT skills training for adults with ADHD. To my knowledge, there are no clinician manuals. Which makes it more difficult then for the clinicians to learn that kind of treatment specifically for adults with ADHD. Okay.
So practically speaking, DBT for adult ADHD just might not be easy to find. And I guess a follow-up question here from someone is, where can clinicians go to be trained in CBT or DBT for ADHD specifically?
Right. Well, for CBT, it's some of the slides that I had up there. So the books by Stephen Safran, Mary Solanto, Russ Ramsey. So those are books written for clinicians that teach them how to provide these treatments. For DBT skills training for ADHD and adulthood, there, like I said, there are no materials like that. So if a clinician were interested in doing that, they'd have to be DBT trained and basically adapt it for ADHD behaviors. And so that would take a bit more work. Okay.
I need to see. We're running out of time here. There are a number of people who would like to know, understanding that this is in your presentation for adults, at what age, teenage children, late teens, is CBT or DBT effective for children under 21, say?
Oh, yeah, that's a great question. So there was actually a study that was done where they adapted one of these individual CBT treatments for adults with ADHD, and they adapted it downward for adolescents with ADHD. And so I don't recall off the top of my head what the cutoff was, but I believe it was age 13 to 17 to define adolescence. And they showed that CBT had a statistically and clinically significant effect on ADHD symptoms. So these CBT strategies can certainly be adapted for adolescents.
Okay, that's really interesting. And last question, I guess, we're running out of time here. Can CBT or DBT help with the emotional aspects of ADHD? So, rejection sensitivity, emotional volatility, are these the kinds of symptoms that adults with ADHD frequently suffer that can be addressed by CBT or DBT?
Yeah, that's a great question. And so with ADHD, it's not a defining feature, but it's a characteristic, and some would argue a core characteristic of dysregulation. These treatment studies that have been done have primarily focused on ADHD symptoms. Some have included mood measures, but even when you measure mood, you're not necessarily measuring what it sounds like this question is getting at, more of this emotion dysregulation construct. So not just do I feel sad, but how do I respond to myself when I feel sad? And for that, I would actually say that we have some good evidence for mindfulness meditation training for adults with ADHD. And so we actually did a study here, and we had 2 measures of emotion dysregulation in a group of adults who received mindfulness meditation training versus a waitlist control group. And the group that received the mindfulness meditation training, their emotion regulation scores improved as well. So,
interesting.
So I would say, if you're out there getting CBT and you want to know if it has an effect, make sure that you're measuring that and tracking that over the course of treatment to see if it is actually changing for you. And if you have an option to incorporate mindfulness somehow, then that might be a worthwhile consideration as well.
Okay, great. We are having, as you mentioned, a mindfulness mindfulness presentation later this year, so stay tuned for that. And everyone, thank you so much. Our upcoming webinars on November 5th, Tuesday, for partners. My partner has ADHD, how to live happily with diagnosis, and then optimizing ADHD medication with William Dodson on November 13th. So I can't thank you enough. This was super helpful. I think this is a topic of huge interest, and everyone, you'll be able to listen to this again. There was a lot of information here. You will find the replay on our website if you'd like to take another listen or share it with someone in your family or your practitioner. So thank you so much, and I hope you'll come back and present again.
Would love to.
Thanks, everybody.
Thank you.
Bye.
For more Attitude podcasts and information on living well with attention deficit, visit attitudemag.com. That's ADDITUDEMAG.com. That's ADDITUDEMAG.com. That's ADDITUDEMAG.com.